everyone, welcome back to another great webinar hosted by Nutters, and we are very excited to have Dr. Brunel here with us to talk about men's health. He is with the New Roots Herbal Group. And just a couple of housekeeping items before we start the presentation. If you have any questions, feel free to pop them in either the comment section or the Q&A section, and we'll get to those towards the end of the presentation. We also have, we will be recording the session. So for those who maybe have to pop out early or couldn't attend, we will send out a recording to everybody as well. And the presentation should be about an hour or give or take somewhere around there. We should be on the call for about an hour. And that's it for me. So Dr. Brunel, I'll pass it along to you.
Thank you very much. Thank you for having me on the show. I'm super excited to be here with you guys tonight. I'm really excited to talk about men's health. It's an area where, of course, I see a lot of male patients. So I'm very familiar with some of the most common ailments that affect men. And yeah, I'm excited to talk about some of the things we can do to help men live healthy, long lives. So quickly about myself, I'm a naturopathic doctor. I have a bachelor in sciences. I went to McGill University. I did human nutrition there. So I grew up in Montreal, and human nutrition was very interesting, but I didn't feel like I had quite enough tools to really help people the way I want to be able to help them. And so from Montreal, I went to Toronto, and there I studied naturopathic medicine at CCNM. And from there, I moved to Calgary, and I've been here since. So I moved here in 2004. So some of the common problems that affect men, by far, I think the most common is prostate issues. Very common to see men that are having issues, symptoms associated with an enlarged prostate. When I started my career in 2004, I would see a lot more advanced prostate cancers. Thankfully, that's changed a little bit with the use of the PSA test. So the PSA test monitors the size of the prostate, and it's been used more and more since 2004. And most men older than 50 or 45, if they're more at risk, should get that tested. And so it's really allowed us to identify problems sooner, and we can focus on prevention wherever we can. But if we need to, when the problem is identified sooner, of course, there's usually better outcomes. So benign prostatic hyperplasia is definitely what we see the most of in terms of prostate issues. We want to make sure that it is benign prostatic hyperplasia, obviously, because we have to rule out prostate cancer. There's lots of recognizable signs, and I'll talk about those very soon. Get tested. So again, digital rectal exams used to be the gold standard, but right now we focus more on the PSA, and it's a great test, and it tells us what we need to know. There's lots of nutraceuticals, so different supplements that can be used to help manage BPH and help keep the prostate healthy overall. And typically, other things that I see often affect men are more issues in terms of injuries, pain, inflammation, problems with the immune system. Men tend to be hard with their bodies, and the biggest risk of developing osteoarthritis is to have suffered an injury. And so I see lots of men that were active when they were younger. They ended up with, injuries to their knees, their shoulders, their back. And as they get older, it becomes a struggle to maintain their level of physical activity. And of course, that has a profound effect on long-term health and chronic illness. And so we want to try to manage inflammation and help them recover, prevent those injuries whenever we can, or there's those problems from developing in the first place. And then there's lots of coping strategies, supplements, but also things we can do in terms of lifestyle. So BPH, again, very common. So you can see some of the statistics here. Basically, if men live long enough, above the age of 100, almost all men have some type of enlargement of the prostate gland. Of course, that's a problem because the prostate is around the urethra. And if it starts to enlarge, the prostate is encapsulated, so it's in a membrane, and so it can't move out that much. Then it starts pressing against the urethra. And of course, that's when we start having problems and symptoms, like, for example, problems with voiding. But yes, very common. And most men, like I said, if we live long enough, we're going to have some problems. So we want to exclude that this could be something else, namely prostate cancer, like I was saying earlier. Some of the signs of an enlarged prostate: frequent, urgent need to urinate. So lots of urgency. Increased frequency of urination, especially at night. And so that's often one of the first signs because it's disruptive, and then it leads to fatigue. And so men will often come in because they're not getting proper rest. Difficulty starting urination. So difficulty, like it's urgent, but then it's hard to start peeing. There's a weak flow. So the stream of urine itself is severely diminished. Dribbling at the end of urination, and then often can't feel that the bladder has been emptied fully. And so, very annoying symptoms. And it really impacts quality of life. There's no doubt about that. It affects sleep. It affects the ability to leave the house sometimes, be in the car. It's really not fun. So could it be BPH? So some of the most common signs, like I was mentioning earlier: urinating frequently, every 2 hours or less, urgency, so it's hard to delay urination, frequent stopping and starting during urination. So again, the flow is impeded. Straining, so it's hard to begin urination, weak stream, and then feeling like the bladder is not completely empty. And then, of course, problems at night. As I was saying, some of those symptoms also common to prostate cancer, right? If the prostate, there's something growing in the prostate, then it presses on the urethra as well. The diagnostic tests, though, are very good. Again, the PSA mainly. It leads to an early diagnosis. It could help save your life, obviously. One of the things that I see right now, because of COVID and the difficulty in getting blood work, a lot of my patients have not had their regular blood work. So certainly if there's any symptoms and we don't have blood work for a while, there definitely should be blood work done as soon as possible. So get yourself tested. If it's a case of cancer, then there's lots of treatments available, and there's things we can do with natural supplements to help as well. And if it's diagnosed as BPH, which again, that's the most common problem affecting older men when it comes to prostate health and prostate symptoms, then there's lots of different herbs that can really help manage symptoms quite effectively. And I see it all the time, significant improvements fairly quickly. And we'll talk about those in a minute. So some of the supplements or some of the nutraceuticals that have research for the management and treatment of BPH: saw palmetto. Saw palmetto has been used for a long time. We understand the mechanism of action quite well. It blocks the enzyme that converts the precursor to testosterone into the active form of testosterone. Lots of different drugs, prescription medication target that same mechanism. And when we use plants, we want to use a standardized extract to make sure that we're getting the active ingredients. Rye flower pollen extract, lots of research there too. Does the same thing as saw palmetto in terms of blocking that enzyme that leads to the active form of testosterone. It's also a potent antioxidant and reducing damage associated with free radicals, helps to decrease inflammation. And it's also known to contain some anti-inflammatory compounds, so it reduces inflammation in the prostate, so it helps to shrink the prostate. Plant sterol, same thing, huge effect on inflammation. Pumpkin seed oil, lots of research with pumpkin showing that it helps protect the prostate. Contains lots of antioxidants that are known to be helpful for the prostate. Stinging nettle changes the membrane of the cells, the prostate cells, and it makes them less likely to react to testosterone. So it has a lessening effect in terms of the effect of testosterone, and testosterone is an anabolic hormone. So it causes things to swell and grow, including the prostate or especially the prostate. In terms of products offered by Herbal, Prostate Perform is an excellent product. I've used it with many patients with great results. Again, improvements in symptoms fairly quickly. It also includes, on top of those ingredients, lycopene. So that's the pigment from tomatoes, which is known to help protect the prostate, decrease risk of ending up with issues like prostate cancer, prostatitis, or BPH. It has some zinc, some vitamin B6, selenium, alanine, glutamic acid, and glycine, all things that help to support prostate health. Okay, so in terms of another common issue that I see men suffering from, this is probably one of the most common complaints. I see a lot of patients that have arthritis, again, most of the time because of previous injuries, but sometimes it can also be chronic inflammation elsewhere. And so what can we do to help men be as active as they want to be as they get older? So in terms of inflammation, of course, we often associate it more with arthritis or inflammation around our joints, but it can also be elsewhere. We can have inflammation in our gut, for example, and I see lots of issues with things like diverticulitis or irritable bowel syndrome or inflammatory bowel disease. Those problems are fairly common. Our diet doesn't have enough fiber, and so often there's lots of gastrointestinal issues. So inflammation can be anywhere, and simply because your knee is in pain doesn't mean that taking measures to lower inflammation everywhere in the body wouldn't be beneficial. It also doesn't mean that the inflammation is only coming from your knee. I see lots of patients that have autoimmune problems and the inflammation builds, for example, with Crohn's disease in the gut mostly, but then they also end up with inflammation that starts affecting their joints. And so the inflammation is central. So we want to try to do things to lower inflammation everywhere when there's an issue with inflammation. Another issue that I often see being a problem is fatigue, and especially in this post-COVID world, I see lots of chronic fatigue. It's always been a very common complaint, but I think there's more now. It used to be about 25% of patient visits, and I think it's a little bit more these days. Fatigue is a major issue. Big problem, of course, is lack of activity. So again, if there's arthritis and someone's not able to exercise, it will lead to all kinds of other issues, problems with sleep, mental health, and difficulty in exercising. So, we want to target inflammation, but there's also other things to look at. And one thing that's really interesting to know is that one of the main benefits of being active and exercising is that it controls inflammation. The number one benefit of exercise in terms of our health is that it lowers inflammation in our body. And we know this from studies looking at classic inflammatory markers. If we look at something like CRP, which is a classic inflammatory marker, when someone exercises, CRP is much lower. Years ago, I used to do lots of work with athletes at WinSport or COP. And one of the things that really surprised me is I was expecting them to have very high inflammation because most of them exercise 4 to 6 hours a day. And I felt that the exercise would really increase inflammation, but it's the opposite. They had the lowest inflammatory markers that I've seen in all patient populations combined. and it's really the exercise. So unfortunately, if someone is hurt and there is a lot of inflammation and the knee, the shoulder hurts, it becomes hard to exercise. And then we're in this vicious cycle of inflammation, and we want to try to break that. So what are some of the other things that we can try? Elimination diet for sure. If there's something that's triggering an immune response, something that your gut doesn't like, that creates inflammation, then that inflammation again goes everywhere and will start affecting everything else. We want to reduce processed food. We know that fruits and vegetables are higher in antioxidants, and they also contain things that help to reduce inflammation. So if there's not enough of that, but on top of that, that gets replaced by highly processed foods, things that are high in sugar, that cause a rapid rise in our blood sugar levels, that promotes way more inflammation, way more free radicals. And again, inflammation builds throughout. The other thing to consider is antioxidants. And one of the ones that has great research, especially in men, is vitamin E. And one of the areas where men are more at risk is their heart. That's because estrogen in women helps to decrease the oxidation of LDL, or bad cholesterol. And so we think that for that reason, women are less likely to have heart disease, things like stroke or heart attacks. So men are a lot more likely to have those issues. Vitamin E is one of the things that can really help the prevention of the oxidation of the bad cholesterol. And so really helps to decrease problems associated with heart disease. It's also a powerful antioxidant, but also anti-inflammatory. So it reduces inflammation. And unfortunately, a lot of us don't get enough from our diet alone, especially when there's more refined food. A lot of the vitamin E has been decreased in our diet based on the oils that we use. And so, yeah, for a lot of people, it's a supplement that should be considered. The supplement offered by New Roots in terms of the vitamin E is called vitamin E8. And the reason for that is contains all 8 forms of vitamin E. So the tocopherols and the tocotrienols. And it's really important to have all of those. Initially, when researchers started looking at vitamin E, they saw that the alpha tocopherol was the one that had the highest reuptake in the liver. And because of that, they assumed it was the most important. And what we found out since is that other of those molecules are better at protecting the prostate, better at protecting the heart. And so only supplementing with the alpha tocopherol is not ideal. You really should be looking at all 8 of those molecules to get the full benefits. So if we look at the benefits of an elimination diet, so this is from Gaby's, one of my favorite lecturers, who's a medical doctor in the US. And he did a literature review on the use of elimination diets and what kind of health benefits could be expected from that. And so there we're trying to basically put patients on a restricted diet and then reintroduce things. And then if there's symptoms, those foods are then eliminated, at least for some time. Some of the most commonly removed foods, of course, are gluten, dairy, but it can include other things like nuts, soy, seafood, all kinds of different things. And so if we use those types of interventions, we can get some significant benefits, especially for the bowel, right? So in terms of IBS or IBD, studies that show significant benefits. Asthma, lots of studies. Again, if something is triggering inflammation in your gut, that also affects your airway and can lead to breathing problems, for headaches, and of course for arthritis. So again, inflammation in the gut goes everywhere, and then all of a sudden your knee starts to hurt from an old injury or from whatever it may be. So we really want to make sure that what you're eating is not going to be triggering those symptoms. And the use of an elimination diet can be very, very helpful for that, obviously. Some of the nutrients that can be used to control inflammation, and I use these all the time. I think inflammation is one of our biggest problems now in Canada. I see lots of patients that are not exercising, again, especially since COVID. With all the gyms closing, I find that a lot of people have struggled to return to their exercise programs. Weight has gone up for most of my patients. More weight leads to more inflammation. So there's less activity, often more weight, which promotes more inflammation. Those nutrients are key in my practice. One of the most important ones is, of course, fish oils. Fish oils are really, really important in terms of blocking the inflammatory cascade in terms of the cells. It diverts most of those pro-inflammatory cytokines, immune messengers that tell the body to produce more inflammation, diverts that towards more anti-inflammatory cytokines. Lots of research. Most of us are not getting enough. I used to be part of a large health and prevention program called Pure North in Calgary. We tested thousands of patients to look at how much of the different oils they were getting in their diet. And most of the research agrees that for every omega-3, we should be getting a maximum of around 10 on the higher end of the other oils. And the average in Alberta was 1 to 23.5. So most people are not getting enough fish in their diet. You should be getting fish at least twice a week, but even that is not optimal. Optimal is 5 times a week, and most people can't do that. So a fish oil, I think, great investment for most people. Reduces inflammation, reduces risk of heart disease, reduces the risk of arthritis, really helps to support mental health. Really, really important supplement. The other one is probiotics, and of course, probiotics. I think I say this all the time, and I really mean it. I think probiotics could change the world. One of the biggest problems we have now in Canada and the developed world is a lack of exposure to bugs in the environment. And that's great when it comes to catching tuberculosis, but when it comes to the immune system getting some practice, that's not ideal. So probiotics could help fill that void by providing practice to the immune system in our gut, to things that are not dangerous to us. So it's something the immune system sees, and it stimulates the immune system. And the more things the immune system is exposed to, the less likely it is to misfire and cause autoimmune problems. But we also see from research that if there's more things that are entertaining our immune system, decreases overall inflammation because the immune system is more balanced overall. So probiotics, again, most of us really should eat more fermented foods. The problem is I tell people to eat more fermented food, and then they go at Costco and buy a yogurt that's going to give them 15 grams of sugar per serving. I don't think that's ideal. The other thing is with fermented food, we can't control quantities of bacteria. So I do think probiotics for most patients, I recommend them for everyone, especially children, but most adults would really benefit from them as well. The last one that I use all the time is curcumin. Curcumin has tons of research derived from turmeric, as I'm sure you know, one of the best anti-inflammatories available. It was one of the only ingredients where Health Canada allowed a claim that it could be used to decrease the symptoms associated with osteoarthritis. So certainly in cases of inflammation of the joints, I always recommend it. We understand the mechanism of action. It's a strong antioxidant. It blocks a lot of the inflammatory messengers, including NF-kappa B. It's unreal how much research there is on curcumin. Problem is absorption and potency. And in the case of the product offered by New Roots, it is validated to 95% curcuminoids. And it's formulated with piperin for advanced bioavailability to help increase the absorption in the gut. Lots of research on inflammation, joint pain. So yeah, excellent product for most people. Helps to decrease things like risk of diabetes, helps control blood sugar. So I use it all the time and I recommend it every day. Another strategy that we can use in terms of acute pain or pain overall or inflammation is topical DMSO. Mechanism of action is somewhat understood. We know that it's definitely a strong anti-inflammatory and antioxidant. Lots of research too with pain. It goes through the skin with a lot of ease. And so one of the concerns, of course, with anything that's used on the skin is will it reach a painful joint? And it's often used as a carrier because it can go in the tissues with a lot of ease. And so it can be super helpful for injuries or acute pain. In this case, Herbal has a liquid DMSO, and it's concentrated. It delivers targeted relief from acute pain, inflammation. Use it for arthritis mainly. So it helps to soothe pain in muscles. Lots of research showing that it definitely decreases inflammation in muscles, tendons, ligaments, knees. So it can be very useful in a case of injuries. So some of the new Herbal products that are available at Nutter's stores, and they will be on special, as you can see here, as of November 17th. So we've talked about most of those, right? So Prostate Perform stops the urgency and strain of urination. It helps to decrease symptoms at night, does not cause side effects, which is one of the main benefits with a lot of the medication. There's pretty severe side effects. Often there's going to be problems with erectile function. And of course, nobody wants that. It also acts quickly. We see results typically in as little as 7 to 10 days. So really, really useful in the case of BPH especially. Curcumin. So we talked, of course, about the curcumin, one of my favorite products. It's a strong anti-inflammatory. The product is standardized to 95% curcuminoids. Lots of research in terms of joint health and joint pain. The liquid DMSO, concentrated liquid, helps to decrease pain, especially in the case of acute injuries, but also for chronic pain like arthritis. And then the vitamin E, E8, I think it's key that formulas with vitamin E provide all 8 molecules. One of the things I didn't mention earlier is if you only use the alpha tocopherol, it tends to outcompete the other vitamin E molecules that you would be getting from food, for example. And some of those are really important. And for the prostate, the delta tocotrienol is often considered more important. The gamma tocotrienol is also key for the heart. And so if you only use the alpha, it's not ideal. So in this case, all 8 forms of vitamin E, powerful antioxidant. It can really help protect the heart, protect the joints as we get older. There's research showing that vitamin E also decreases the risk of osteoarthritis because it's such a good antioxidant, but also anti-inflammatory. In this case, it's in olive oil. And yeah, can help, of course, with the skin as well. But those are the products that I want to discuss today. Are there any questions?
Thank you, Dr. Brunel, for a great presentation. Lots of good information. If anybody does have questions, be sure to pop them into the chat window or in the Q&A section, and we will get to them. One question for those listening, if somebody has questions maybe for you, or they want to get a hold of you, or maybe follow you on social media, what's the best way for them to reach you?
Either email, which is my first name dot last name, so ludovic.brunel@gmail.com, or my website has contact information as well. It's drludobrunel.com.
Fantastic. Thank you.
For sure.
Anybody? We have lots of time for questions. Oh, we do have one in the Q&A section. What's the best way to get probiotics by food or supplements?
Yeah, great question. It is one of the key things when it comes to probiotic supplementation. There's no doubt about it. When babies are born, when infants are born, the pH in the stomach is very, very low initially. And that's how our gastrointestinal tract is colonized initially. As we get older and as food gets introduced to our diet, the stomach really starts to produce a lot more acid, and that acid is very strong. So when the acid, especially when we start eating meat, for example, when the acid is a lot higher, then one of the key things the acid does, it protects us from infections because it kills things like bacteria. And of course, probiotics are bacteria and they're live bacteria. And so we want to make sure that they will survive transit through the stomach. And so in the case of probiotics, one of the things that I love about the New Roots Herbal line of probiotics is that most of them are enterically coated. And that enteric coating prevents the acid from entering that capsule. And the capsule only disintegrates in a pH of about 5. The pH in the stomach is 2. 1 or 2. When it reaches the intestinal tract, the pancreas dumps all this bicarb, it lowers the acidity, and then that capsule disintegrates in the small intestine. And those bacteria are then alive. They've not been exposed to the acid, and then they can do their thing. They can stimulate the immune system. They can outcompete harmful bacteria. So that's one of the key things. The other thing in terms of probiotics, again, that New Roots does very well is using refrigerated strains. And the reason for that is most of the research is done on strains of bacteria that would be in fermented foods. And a lot of those need to be refrigerated. And so if we only use things that are room temperature stable, we are really eliminating a whole bunch of strains of probiotics that have a lot of research, probably more research, the most amount of research. And so I think that's another thing to consider. Other things, if you're going to use food, that's great. If you're using fermented food, one of the benefit is that the food helps to buffer the stomach acid a little bit when we eat. That bolus of food neutralizes some of the acid, so that can help some of the bacteria survive. But yeah, I think those are some of the key things.
Next question. Oh, sorry.
No.
Next question, is olive oil rich in all of the E vitamins?
Great question. Most of the food sources are high in will have a distribution. Olive oil and most food sources are higher in, I think, gamma than alpha, but that is a correct statement. They would have all the different vitamin E molecules in olive. I don't know in terms of the oil. I would have to research that more. It's possible that in the extraction process, we might lose some of it, but I would expect most of the vitamin E would follow the oil. So as long as the oil is not heated too much, we should retain lots of vitamin E. But then the problem is, what are you going to do with that oil? If you're going to cook it, you're going to destroy some of it. So there's that as well. Food preparation will have an effect on the amount of oil left in the end. And then how's that oil kept? You know, if you're like most people and you keep oil under the sink for a long time, that also gets oxidized, and a lot of that vitamin E will be oxidized as well.
Excellent. If I have prostate cancer, can I still use the products that you mentioned tonight, or is it too late?
No, there's always things we can do naturally. It depends what kind of conventional treatments you would be receiving. If we're going to be doing if we're going to be doing radiation or chemotherapy, then sometimes we have to be careful with some things that are antioxidants. If you're going for surgery, then we want to make sure there's nothing that's going to be a blood thinner. But it's certainly never too late. But it would depend on the patient, specifically the stage of the prostate cancer and what type of conventional treatments are going to be done. Yeah, so it kind of needs to be individualized, but typically we would be able to use things like Prostate Perform, at least at some stages, depending again on what else is happening.
And just to follow up to the vitamin E question, would gel capsules be a good option to get the most vitamin E out of the olive oil?
That's a good question. One of the things that surprised me when I was doing research previously, probably for another presentation, but anyways, when I was looking at fish oil, I always imagined that an oil that's encapsulated would be more protected than an oil that's just free liquid in a bottle. And I was surprised when I looked at the research, when they compare soft gels to a liquid in a bottle, sometimes there can be more oxidation around the soft gel. So in terms of encapsulating olive oil, I'm not sure that it would be better to protect the oil from oxidation. Yeah, the other thing is, I don't know how much how much vitamin E there would be in olive oil, but you might need a significant amount of olive oil to get the daily dosage of vitamin E that's typically recommended for prevention of things like heart disease, for example. So yeah, I would recommend using a vitamin E supplement to get vitamin E.
Next question is, does inflammation in the prostate also show up in other areas of the body? So for example, maybe there's inflammation in your knee as well.
As soon as something is inflamed, I find that we get inflammation everywhere. So if your weakness is your gut, you may have more issues with your gut if there's inflammation coming from somewhere else. Typically what I see, especially when there's an autoimmune flare-up, there'll be inflammation of, let's say, the gut, and then all of a sudden old injuries start to flare up in the knees and the shoulder and the back. There's more fatigue, discomfort. Just when inflammation builds, we don't feel well. It affects everything. The brain picks up on inflammation. Like a lot of the chronic fatigue that we think is happening with long COVID is that the body's been exposed to a lot of inflammation. The brain saw that, and the brain puts the body in a rest mode to try to recover. Unfortunately, what we think is happening is that as things improve, that signal for some patients with long COVID doesn't go away. And so the brain is still telling the body, rest, rest, rest. But that's all mediated by inflammation. The root cause was the inflammation that was associated with the viral infection. So a similar thing happens all the time. In practice, I see it all the time. All of a sudden, everything hurts because something is inflamed. Now, something that's very large, that's inflamed, is going to cause more problems everywhere. So typically we see that with the inflammatory markers in the blood. If the inflammatory marker is sky high, then there's more symptoms throughout. That's usually what I see.
And what could cause inflammation to roam around your body?
So sometimes it's really hard to understand where inflammation is coming from. It could be a chronic infection. It could be an old injury. It could be your gut is unhealthy. It could be medications you're taking. It could be lack of exercise. It could be obesity. Often we search a long time and sometimes we can't even figure it out, but there can be chronic inflammation in most organs. You know, your liver could be inflamed, or it could be diabetes, it could be heart disease, your blood vessels could be inflamed. But once inflammation is high, we often see it everywhere. And I have an autoimmune problem, and if I'm in a flare up, I broke my ankle when I was 16, that foot is unbearable. And so the inflammation from my gut went to my blood and it sent inflammation everywhere, including in my ankle. And so that's typically what happens. But what could cause that? Almost any illness will always produce more free radicals and more inflammation. So it's hard to say what it could be. But you know, typically some of the things we talked about, things like fish oil, curcumin, more exercise, more rest, but we also need to make sure there's nothing else going on. And that's where blood work and seeing your family doctor can also be very useful.
And does BPH have a direct link or increase prostate cancer risk?
That's a really good question. The answer is no, not at all. Yeah, there's no cancer cell in BPH, so it's not that a cancer is taking space. It's just the cells that are increasing in size, typically because of the prolonged exposure to testosterone. As men get older, there's been more and more exposure to testosterone, causes some swelling of the prostate. And you know, in some cases, some researchers feel that the reason why testosterone levels decrease as we age is specifically because of the prostate. But typically, no, the two are totally separate. There's no risk. You know, just because you have BPH doesn't mean you're going to be more likely to have cancer. Definitely not.
And kind of a two-part question. Would it be beneficial to take curcumin with Prostate Perform at the same time to help inflammation? And if you were to double up on taking the Prostate Performance, would there be any side effects from doing that?
No. So first answer to the first question, you can definitely combine them. I do it all the time. I think it's a great idea. Curcumin has lots of research in terms of protecting the prostate, but also decreasing inflammation, alleviating symptoms associated with the swollen prostate. Helps prevent things like cancer. So certainly using those two together is totally fine. Prostate Perform, you can certainly double up on the dose. Often we tell people for the first week to take one at lunch, one at night, and then after the first week to just take one in the evening. So yeah, taking 2 a day is fine. The ingredients that are in there, even if someone takes 2 capsules, it's not going to be enough to cause any issues. Not sure that would be more helpful. Certainly can be tried. You should see if there's an additional benefit within about a week. So it's definitely a possibility. I have had men that have said, when I decreased from 2 a day to 1 a day, didn't feel as good. So I felt like there was more symptoms, and they'll keep taking 2 in that case. And I think that's fine.
Excellent. And just to follow up to the roaming inflammation question, he's talking more specifically about the inflammation moving from his hands to feet to knees. Any idea on that?
That sounds like arthritis, obviously. Why is that happening? Why is it moving from one area to the other? I'm not sure. It could vary depending on, you know, the task that were performed that day. If you're using more of your hands one day, it may cause more inflammation or more pain in those areas, for example. I think the strategy would be the same. I would like to know what it is, but if it's osteoarthritis, which it definitely could be, then again, it's to address inflammation. So some of those supplements that we talked about should be helpful, especially curcumin and fish oil, but also probiotics. General exercise, yes, but when people tell me I go for a run and then I can't walk for 3 days, well, that's obviously too much for whatever joint hurts. So then we have to modify the exercise. Less impact is usually going to be more tolerable. And then other crutches like taping the joint or using a brace or some type of sleeve can be useful. But typically with exercise, people tell me, yeah, sometimes it's uncomfortable, but it doesn't usually make things much worse. But there's lots of people that can't run past a certain age because their joints are not able to handle the impact. So I see that all the time. And then I would do something different. But yeah, it sounds like arthritis. So I would treat it as arthritis essentially.
And have you heard of MCT oil? If yes, do you recommend it and why?
Yeah, of course I've heard of it. It's not a product that I use a lot of. It's usually derived from coconut oil. And in certain patients, I've seen it in some cases increase both HDL and LDL cholesterol, so increase total cholesterol. And yeah, so for that reason, it's not something I use a lot of. If people are on a keto diet or trying to lose weight, excuse me, sometimes they'll be using it. It's supposed to help carry fat out of the system. I don't see great research on that. There's some indications that it can be useful. I would use it as another type of fat. But in terms of a lot of the health benefits, I think we need more research for some of them. But the biggest problem we have is that we overconsume carbohydrates. And so my bigger concern is typically to try to reduce the amount of refined sugar. And if that means that they'll be using MCT oil, I think that can be great in terms of, people that want to do things like intermittent fasting and they want to use something in the morning to help control their appetite. I don't have any problems with that. I have lots of patients that struggle with weight. It's our biggest public health problem right now in Canada. 64% of Canadians are too heavy. And so if they want to do intermittent fasting and that helps them, I definitely don't have an issue with it. So I don't know if there's a more specific question about MCT, but I'm kind of in the middle. I don't push it on patients. I would rather they use a different oil like a fish oil. But if it's something that they've incorporated, it's helping them maintain healthy weight, then by all means, I don't have any issues. If their cholesterol increases before and after using it, then typically I would tell them to reduce the amount they use per day or discontinue it completely and switch to something else. But people often use in their coffee, and of course I think it's going to be hard to convince someone to put fish oil in their coffee. So I get that as well. But yeah.
A question about reducing carbohydrates and processed foods and sugars and things like that. Do you recommend doing it slowly or kind of ripping off the Band-Aid and eliminating them altogether right away?
Sorry, I missed the very first part in terms of decreasing refined foods and sugar.
Yeah. Do you recommend doing it slowly or kind of eliminate them all and run with it right away?
It depends what the person is comfortable with. I often tell patients, you have to tell me what you can do, and then we'll go from there. But a lot of people will tell me, I want to make a new start. I want to start exercising. I want to eat properly. I want to feel better. And so if they don't feel like it's going to be too much, I tell them, yeah, for sure. Other people, I feel like it has to be small step. Like I often tell patients, little train goes far. Like, don't be too hard on yourself. We can't, Rome wasn't conquered in a day. You for now, just add more vegetables. That's the number one recommendation that I make to patients when it comes to their health. Just add more vegetables. It'll displace some of the bad food. It'll help you control your weight. It's what's most important in our diet. And it's what lacks most. The recommendation is to get about 8 to 10 servings a day. and less than a third of men are getting 5 servings, and less than half of women. So it's our biggest problem. After that, it's refined sugar, and our kids eat tons of sugar. They're the category that consumes the most. And so at home, I start by not having any of that stuff around. And there's no juice, there's not candy here. And so for patients, that's what I tell them too. Like, you don't have to throw out all the food that's in your pantry, but maybe some of the highly refined stuff that's full of sugar, and then try to replace that slowly with healthy stuff that has more fiber, complete grains, and try to eat at home as much as you can. Don't stop at the gas station to buy junk. Be prepared, bring food with you that you've made that's nutritious. But for a lot of people, it has to be small steps, because food socially is important. And so I don't want to cause too much change and then they get discouraged or their gut reacts poorly. But like I said, I have some patients, they come in, it's mid-January, and they say, this is my New Year resolution. I can handle a lot. Let's do this properly. And then we'll make a full meal plan. I'll tell them to empty their pantry and start from scratch. And, they find a new routine. And after a few weeks, we're off to the races. But most of the time, it doesn't work like that. If we're dealing with a family, there's other family members to consider, and changes have to be incremental. Otherwise, there's going to be pushback.
Can you touch on how stress can have an impact on inflammation?
Yeah, for sure. Stress, I think is one of our biggest problems in terms of our modern life. There's tons of stress, especially lately. Mental health is the worst that I've ever seen. There's financial stress. There's this COVID has caused, a lot of aggravation for a lot of people. Stress, directly causes inflammation because it ramps up all kinds of hormones that are known to basically sacrifice long-term health for rapid energy, and just not the best thing in terms of controlling inflammation. If there's more stress, blood pressure will increase, and in terms of our overall health, it's not great. Now, stress is also a proxy for all kinds of other things. We have studies where one of the studies I often mention is a study that was done in a large department store, and they looked at what people were eating before Christmas, and then they looked at what happened when it's super busy around Christmas. And what happens when we're stressed? All of our coping strategies start failing. We don't eat properly, we don't exercise. We want things that are high in energy to help us fight or flight. And so we increase the amount of sugar and the amount of fat that we consume. There's no time for proper food preparation, not proper rest. It's hard for mental health. There's an increased risk of addiction if your mental health suffers. Stress management is a big problem for a lot of us, including myself. Our life is super stressful at times. One of the other things that helps us manage stress is to have support systems. And if we look at the amount of close contact or close friends or social support people that the average Canadian has, it's dwindled since our parents. And most people now only have one or a few people that can really help them if they need serious help and they're in trouble, they're sick. And of course, that increases stress. If you don't have a community that can help you and you need help, then you're in trouble, and it's very stressful. And so all those issues tend to affect men more. Men are way more likely to suffer from loneliness and isolation. When there's a divorce, men don't do as well. Their life expectancy decreases significantly because loneliness is really bad, and it decreases their ability to cope and to cope with stress specifically. So certainly, having some ways of dealing with stress is important, but sometimes there's outside factors, right? I had a patient tell me, I did meditation, I exercised, I took time to rest, nothing helped me decrease the stress in my life more than having a job that paid more and allowed me to deal with my financial situation. So unfortunately, modern life is very, very stressful. And so we all need to be aware of it. We need to understand where the stress is coming from, and we need to medicate it as best we can.
Excellent. We have about 5 minutes left, so time for maybe one more question. If those who are on the call have one more question for Dr. Brunel, that would be awesome. Oh, just a nice comment. Thanks for sharing. Very relevant and informative. So that's awesome.
Great. Thank you very much. Yeah, it's a topic that's important to me. I think, men are not great at asking for help, and that's very unfortunate in a lot of situations. And yeah, so I'm always happy to discuss things that can be done to help men take better care of themselves.
All right. If there isn't any other questions, maybe we'll wrap it up there. Dr. Brunel, a very informative topic or talk tonight. Great information, and we really appreciate you taking time out of your day to talk to us.
For sure. Thank you so much for having me.
Excellent. Well, guys, if you don't have any other questions, we'll wrap it there. And thanks for joining us.
Thank you so much.